Menopause. Hi, I'm Shreya. I'm a medical professional. I specialize in musculoskeletal health, chronic pain, and menopause. And I'm here to talk to you about the menopause transition. There's so much we hear these days about menopause, perimenopause, and it's important to know what's happening in our body, but also when are these processes starting? When should we be aware of the changes beginning in our body, and what does it all mean? So let's start at the very beginning. What's happening in the female body? Well, let's talk about the hormone estrogen because it's got a lot to do with menopause. Estrogen is an everybody hormone. I really like to emphasize this because we often think estrogen is a female only hormone, but it's not. Men have estrogen and women have estrogen. The levels of estrogen in our body changes as we go through different transitions in life, such as puberty, monthly menstruation, pregnancy, they skyrocket at this time, and finally menopause, when estrogen levels start declining. When a woman is born, a female baby, she is born with all of her eggs that she's going to have throughout her life. So whatever this may be, 1 million, 2 million, 5 million, she is born with all of those eggs. When we come to the transition of puberty, we release an egg every month. This is the process of ovulation. So during the process of ovulation, through a complex feedback loop of hormones, the egg is released and our ovaries produce estrogen. Now, eventually, the egg supply runs out because every month we release about 11,000 eggs, sometimes more, for one or two to make it to the finish line. The egg supply starts declining, our hormones start fluctuating, and this is the process of perimenopause. When the egg supply finishes completely, we reach menopause, and that marks the end of our reproduction. Menopause is defined as when a woman has been free of her periods for 12 consecutive months. So if you had your period 1 year ago on the 1st of March and you haven't had a period until 2nd of March, that's menopause. Perimenopause is all of the time leading up to this. So this is when our eggs reach that critical low supply and we start getting symptoms. The perimenopause can be 7 to 10 years long, and that is for 60% of the population. For 20% of the population, this is less than 10 years. And for 20% of the population, this is longer than 10 years. Every woman is different. There are no blood tests to tell us when we are in the perimenopausal phase, and this is diagnosed primarily through clinical symptoms. And we have a constellation of symptoms that tell us we are in perimenopause. So with this perimenopause phase, this is actually the most turbulent phase. It's a roller coaster of hormonal fluctuations, and the brain and the body, they like consistency. During this phase, we have anything but consistency, which makes it very, very hard. So we come to a question of, well, how does that impact our body? The thing is, estrogen plays a role in every organ system and function and process in the body. We're yet to discover an area where there is no estrogen or we don't have estrogen receptors. So estrogen is present everywhere, and therefore all organ systems are affected, not just with declining estrogen, but also with the hormonal fluctuations. It is during these hormonal fluctuations that women struggle the most. Brain has been the biggest area of research to see how estrogen deficiency and fluctuations, along with the fluctuations of other hormones, impact women's health. So you might ask, what can be the symptoms of perimenopause? So we have a constellation of symptoms, and every woman is going to respond to this differently. You have to know what your normal is. So the first thing I tell my patients is maintain a diary, know what your normal is. You should know how long your monthly cycle is. Is it 28 days? Is it 30 days? Is it 34 days? That is your normal. Not every single woman is going to have it at 28 days. So during your perimenopausal stage, not always, but for some women, this can start changing. It's important that you know your normal. Other symptoms might be forgetting things, brain fog, confusion, anxiety, mood swings, loss of confidence, self-esteem, questioning yourself, self-doubt. One of the things women often feel is loss of confidence in driving. Women are far more susceptible to these changes, especially PTSD, depression, and anxiety, than men. The first step is know your normal. You don't know your normal, you won't know your abnormal, and it will take you longer to seek help. Also, when you get to the point of your consultation, you will have less information to provide, which will make it harder to diagnose where you're at. My second advice to my patients is get an appointment at your GP surgery, find out from the receptionist which medical professional has an interest in menopause or sees menopause patients, and book an appointment with them. Make sure you tell them that this is an appointment for menopause, because often these are longer consultations, and then they can block out the appropriate amount of time for you so you're not rushed. If this is a viable option for you, you can then start your own research. British Menopause Society has a lot of patient resources, as do other websites, and I will mention them in the description below. But it's important that you know what your options are. Once you have done the research, you have all the information, you can make an informed decision about hormonal replacement therapy. And my third advice is work on the health basics. Lifestyle is key. If your health basics aren't there, if the foundation isn't there, everything that you build upon on that is not going to be as effective. So few things that you can prioritize and work on is sleep, protein intake, and stress management. Following that, work on refining your diet further, so you cut out the processed foods, sugars, because these are highly inflammatory and impact mood a lot, and they impact hormones a lot. Exercise, so including resistance exercise, strength training, high impact exercise for bone, and also spending a lot of time in nature, because this is invaluable. And we have a wealth of data telling us how valuable spending time in nature is. Get that light, it's anti-inflammatory. You can then work on your gut microbiome, the gut diversity, fiber, but also very importantly, a lot of self-love. As women, we have a lot of expectations from society placed upon us. As mothers, wives, caregivers, professionals, it's never ending. So be compassionate, be kind to yourself. Take your time, slow down during this process, because your body is changing and change takes time. I will be back with more to explain the processes further, talk about symptoms, lifestyle medicine, and how we can go deeper into helping ourselves with hormonal therapy and outside of it. Remember, this is not individualized medical advice, so please do seek advice from your physician. If there are particular topics that concern you, that you would like to know more of, you have interest in, let me know in the comments below. Thank you for your interest.